All right, welcome everyone. We'll go ahead and get started because we have a busy lineup ahead of us. So thank you so much for joining us today for the first in a series of 2 webinars exploring how food policy councils can support food chain workers. We hope you and your families are staying healthy, both physically and mentally during these challenging times, and also want to thank you for all the work you're doing to support your communities. My name is Rachel Santo, and I am Senior Program Coordinator with the Johns Hopkins Center for a Livable Future and the Food Policy Networks Project. Also on the call with us is Karen Basarab, a Senior Program Officer, and Ann Palmer, a Program Director at the Center. We are delighted to welcome Claudia Rosales, Jose Oliva, Christina Spach, and Nessia Berner Wong to share their insights with us today. As the COVID-19 pandemic has unfolded, the effects of decades of harmful labor policies and practices have been thrust into the public spotlight. The pandemic is highlighting the urgent reform needed to support food workers' health and well-being. As well-respected and connected leaders in food policy in your communities, many food policy councils are in a good position to uplift the voices and demands of food chain workers in the food policy sphere. We also recognize that advocating for policies to support food workers is new territory for many food policy councils. Today's call is intended to set the stage by exploring why policy changes are needed and what potential levers, especially during the COVID-19 crisis, are available at local and state levels to increase support for food workers. The second call, which will take place next Thursday at the same time, will explore examples of how food policy councils are integrating food worker voices into their membership, advocating for policies to support food workers, and communicating with decision makers around labor issues during COVID-19. Before we begin the webinar, I want to briefly go over a few logistics. Today's discussion will be organized a bit differently than your typical webinar. We will begin by hearing from Claudia Rosales, who will share her experiences as a farm worker and organizer. Claudia will present in Spanish with consecutive translation by Jose Oliva. Christina Spach will then present an overview of the historical context of food worker exploitation and the problems that workers are currently facing. Following Christina, Jose Oliva will share an example from the Chicago Food Policy Action Council on their policy recommendations around food workers, as a segue into Nessia Berner Wong's overview of the different policy levers that could be leveraged to support food workers. We will conclude with a Q&A session for all panelists. All attendees will be muted throughout the webinar, so if you have a question or comment at any point, please submit your question into the Q&A box or chat into the chat box located at the floating toolbar at the bottom of your screen. If your question is intended for a specific panelist, please include that in the text of the question so we can direct your question accordingly. And for those attending by phone, please hit *9 if you want to raise your hand and *6 to unmute. We will be recording the discussion today and we will share it with everyone that registered in the next few days. And as mentioned before, this webinar is being hosted by the Johns Hopkins Center for a Livable Future, an interdisciplinary center located at the Johns Hopkins Bloomberg School of Public Health. Our work focuses on the intersection of diet, the environment, food production, and public health. The Food Policy Networks Project is one of our projects with the goal to build the capacity of food system stakeholders to reform local, state, regional, and tribal food systems through effective public policy. We do that through training, sharing best practices, networking with other food policy councils and leaders, and developing and providing food policy resource materials. If you're not familiar with the Food Policy Networks Project, I encourage you to check out our website and to sign up for our listserv to hear about future webinars. And before we begin, we'd also like to introduce our speakers. First, Claudia Rosales is the farm worker organizer at the Pioneer Valley Worker Center. Originally from El Salvador, Claudia worked for many years as a farm worker in Western Massachusetts before joining the PVWC staff this spring. Claudia is also a founding member and co-owner of a new cooperative organic vegetable farm, Riquezas de Campo, Richness of the Earth. Christina Spach is a national organizer for the Food Chain Workers Alliance, with over a decade of experience in community organizing and advocating for racially equitable food policy. She currently supports grassroots coalitions in building transparent supply chains that reflect our collective values and protect the dignity of workers. Jose Oliva is the co-director of the HEAL Food Alliance and member of the Chicago Food Policy Action Council. With a long history in labor organizing, Jose has served in several leadership positions at Casa Guatemala, Chicago Interfaith Workers Center, Interfaith Worker Justice National Workers Centers Network, and the Center for Community Change and the Restaurant Opportunity Center United. He is also the co-founder and co-director of the Food Chain Workers Alliance. And last but not least, Nessia Berner Wong is the Senior Policy Analyst at ChangeLab Solutions, focusing on food systems, including equitable procurement, healthy vending, and federal food policy. She previously worked on school nutrition programs throughout the Western United States at the U.S. Department of Agriculture's Food and Nutrition Service, served as an agriculture and food security volunteer for Peace Corps, Nicaragua, and managed the Grand Lake Farmers Market in Oakland, California. So thank you all for joining us, and now we will begin with Claudia.
Hola a todos, gracias por permitirme estar aquí hoy. Yo estoy representando Justicia de Trabajadores del Campo. Trabajo con el Centro Obrero del Valle Pionero. Esta organización construye poder con trabajadores de salario mínimo y empodera a inmigrantes de la comunidad, impulsándolos a que se unan para poder hacer cambios verdaderos en las familias, trabajadores y nuestra comunidad.
Sorry, my internet is a little spotty. I'm going to switch networks. Claudia, solo una nota bien rapidito. Si por favor cuando hablas, solo 2 oraciones y luego me das un permiso a mí para traducir lo que has dicho.
Okay.
So my name is Claudia Rosales. I am a farm worker and an organizer also at the Pioneer Valley Workers Center in Western Massachusetts. And I'm sorry, my internet cut out, so I might have missed a couple of the things that she said. Okay, Claudia.
Okay. Bueno, el COVID-19 está afectando las condiciones y los trabajos de la finca.
COVID-19 is affecting all of the conditions and the work in the fields.
Primeramente, las condiciones están mal ya que no están implementando seguridad social como lo es, en primer lugar, separación de 6 pies, distancia entre los trabajadores o compañeros.
First of all, the conditions have gotten worse because they're not implementing any of the social distancing regulations, like the 6 feet of distance that has been recommended.
No están proveyendo mascarillas ni guantes y no están desinfectando tampoco las áreas de trabajo.
They're not providing any gloves or any other personal protective equipment, and they're not disinfecting the work areas.
Entonces hay mucha inseguridad y falta de protección en los trabajos.
So there's a lot of insecurity and lack of safety in all of our jobs.
Muchas fincas no están contratando personas para trabajar.
Many of the farms are not hiring enough workers.
Y las familias que están trabajando les han hecho pues recorte de horas. La verdad, muchas familias están siendo afectadas por la falta de trabajo.
And those of us or the families that are working all have experienced a shortage of hours, and many workers are just not working.
Y un factor muy importante y esencial en la vida de la comunidad es una licencia para conducir. Por falta de la licencia de manejo, las familias se exponen más al COVID-19.
And another factor that's actually pretty essential to our safety is that many of us lack a driver's license. And the driver's license allows us to be safer. Without a driver's license, we're exposed to COVID-19.
Ya que tienen que andar de 6 a 7 personas en un solo carro cogiendo ride para los trabajos. Y es necesario porque sabemos que estas personas necesitan dinero para sus necesidades básicas.
Because as you know, without a driver's license, 6 or 7 of us have to pile into one vehicle in order to get to work because we have to work in order to feed our families.
Con las licencias de conducir, cada familia podría viajar en su propio carro y podría manejar sin miedo a infringir la ley y aparte a estar expuesto al COVID-19.
If we had driver's licenses, every family could drive their own car, be socially distant and safe without the fear of being contaminated or contaminating others of COVID-19.
Necesitamos las licencias para los emigrantes trabajadores.
We need driver's licenses for all immigrant workers.
Nacionalmente, ya hay muchas personas enfermas con el COVID-19.
At a national level, there's already a lot of people who have been infected with COVID-19.
En una de las fincas de Massachusetts que se llama North Farm, de 50 trabajadores salieron 38 personas positivas con COVID-19.
In one of the Massachusetts farms that we work with, out of 50 workers, 38 of them were tested positive of COVID-19.
Y la verdad no tenemos protección del Estado para estas personas. El dueño de la finca fue el que hizo las pruebas para cada persona.
And to be honest with you, we have no support from the state. It was the owner of that farm that paid for the tests for those workers.
Esto significa que no tienen privacidad en la salud y habían abierto un lugar donde hacían las pruebas para el COVID-19 que estaba situado en el Big E. Lamentablemente no estaban aceptando a trabajadores del campo, pero parece que ya desde ayer lo cambiaron. Así que desde hoy ya pueden ir ellos y pueden obtener su prueba gratis.
This means that they're not prioritizing our health. One of the only free test sites in the state was not allowing farm workers to be tested. Thankfully, as of yesterday, they began to allow farm workers to be tested. So I think beginning today, we will be able to be tested in this site.
Los trabajadores de North Farm fueron pagados por el dueño 30 horas de enfermedad, pero con instrucciones que tienen que regresar a trabajar independientemente si están o ya no están enfermos. Tienen que regresar.
In one of the farms, they were paid 30 hours of sick days or 30 sick day hours with the explicit instructions that they had to come back to work independently of whether they were sick or not.
Ya que el patrón no quiere pagar pues más horas de enfermedad y sabemos, ¿verdad?, que los trabajadores pues tienen miedo por ser indocumentados, tienen miedo de deportación y tienen miedo al COVID-19, los trabajadores del campo.
And we all know that workers are afraid of being deported and they're afraid of losing their jobs, so they will go back to work.
Sabemos, ¿verdad?, que los trabajadores son esenciales como cualquier otro trabajador. Por eso tenemos que empoderarlos, apoyarlos, ¿verdad?, para que pueda haber justicia verdadera.
And as we know, farm workers are essential, like all other workers, and that's why we have to support them and we have to empower them so that they have the rights that everyone else has.
Esto es todo lo que les traía esta mañana y les pido pues que puedan ayudarnos, que nos den ese apoyo y que juntos podamos sacar adelante nuestras comunidades. Gracias por el tiempo que me han permitido el día de hoy y que pasen un feliz día.
Gracias, Claudia. This is the message that I have for you all today. And I just want to, again, ask for your support, ask for your help. I know that together we can pull our communities out of this urgent moment. So thank you all very much for inviting me to speak.
Gracias, Claudia and Jose. Thank you very much for sharing. And we will continue the conversation, and we'll have questions. If you have any questions for Claudia, we can ask them during the Q&A. So we'd like to move on to Christina now.
Thanks. Hi, everybody. I'm Christina Spach, an organizer for Food Chain Workers Alliance, and just want to echo gracias a Claudia. Apreciamos que se haya tomado el tiempo para estar con nosotros hoy. And thanks to Jose for interpreting as well. Such important points that Claudia is raising. And a shout out to the farm workers in New York State who just recently won driver's licenses last year. What Claudia shared is what we're hearing from Alliance members and food workers across the food chain. That is unsafe workplaces where workers lack protection and basic health and safety information. They lack overtime and premium pay, paid sick days and family leave. We've also seen a lot of lack of access to healthcare, and in some areas, lack of access to food, and then also heavier workloads and increased line speeds causing greater risk to worker safety, including in meatpacking plants, which have become a COVID hotspot, where increased line speeds even before COVID meant that workers were standing shoulder to shoulder without time to even cover their mouth when they cough, much less to take needed bathroom breaks. So these are just some examples. And as a food and farm movement, I think it's important for all of us to really acknowledge that our food system's ongoing crisis of corporate greed and exploitative labor practices existed way before COVID, right? We've always known that food workers are essential to keeping us fed, yet they've long been denied healthcare, paid sick leave, consistently been paid low wages, seen as disposable. And that's really why Food Chain Workers Alliance was founded 10 years ago, in part by Jose Oliva, who's on today, and why Alliance members, including Pioneer Valley Worker Center, where Claudia works and organizes, they've been, all of us have been collectively organizing for years and decades to improve wages and working conditions for all food chain workers. So the Alliance represents roughly 370,000 food workers in the US and Canada. These are folks that harvest, pack, process our food, transport, sell, and serve our food. And Alliance members really believe that in order to ensure that all food workers are free of exploitation, we really have to be building worker power across every sector of the food chain. And members have also long been talking about how the labor and exploitation of food workers are invisible to much of the public, and that our government policies and business practices have really failed workers in dangerous and deadly proportions. So while these conditions we know existed before COVID, this crisis has really become a tool to continue to exploit food workers, like what Claudia was lifting up. We're seeing how employers overall have done little to protect the lives of workers. We're also seeing how the food industry is responding. So for example, how Tyson and Foster Farms are continuing to increase line speeds at some of their poultry processing facilities. We're seeing how the growers lobby is continuing to push for the lowering of wages of H-2A workers under this veil of keeping America fed. And also how this administration and how congressional Republicans are really pushing to essentially absolve meatpacking companies of their legal liability to protect workers from the virus. Despite that, despite these life-threatening working conditions, food workers are organizing for safe and healthy working conditions through organizing walkouts and strikes and other collective action. We see how folks like Claudia are organizing farm workers and how communities are really rallying around local food workers, including supporting immigrant food packing workers in Western Massachusetts who organized a walkout over health and safety conditions. They worked with Pioneer Valley Worker Center to publicize and eventually win changes on the job. Burgerville fast food workers led a strike in Portland, Oregon over safer workplaces, premium pay, and family leave. We're also seeing pork processing workers in Missouri who have escalated pressure on their employer, who was Smithfield, by launching a petition and gaining media exposure on how they needed, or what they needed in their workplace. And one worker even filed a lawsuit, all of which collectively has gotten workers at that Smithfield processing facility better protections at the plant. And based on what Food Chain Workers Alliance members are calling for in their own communities, we're really working with labor and food movement allies, some of y'all on this call today, to call on Congress, to call on states and municipalities to protect workers in essentially 3 different ways. So one is mandating premium pay for all food and essential workers, and that means essentially additional compensation for workers who we know are risking their lives right now to put food on our tables. So an example of that is food packing workers in Washington State who are on strike at 5 different fruit companies. And this effort is actually led by Latina and Indigenous women who are calling on the governor for workers to immediately receive premium pay in that state. The second priority is extending aid to all workers regardless of immigration status. A significant number of food workers are excluded from unemployment insurance and other federal benefits because of their immigration status. So for workers who aren't citizens, especially those that are undocumented, there's really little to no options for relief right now. And Alliance members, Migrant Justice and other allies in Vermont have launched a call to action today, actually calling on their governor to pass policy that would provide relief, state relief, to those folks who have been excluded from our federal benefits packages. And then the third priority is issuing COVID-specific health and safety standards to protect our workers right now. On the federal level, that's calling on OSHA. And we've also seen folks calling on the state level, calling on their governors to issue an executive order. So an example of that is New York State's HEROES Act. That is a proposed executive order put forth by an Essential Workers Coalition, and it can provide model language for state health and safety requirements. Today, they actually launched a call to action, and I can share these links in the chat with y'all. And then Food Chain Workers Alliance has launched, along with HEAL, Food Alliance 2 has launched a letter writing campaign to Congress based on these 3 key priorities. So we've seen the House HEROES bill that was voted on last Friday. It includes these 3 priorities in it, but getting the Senate on board, as y'all know, will be a huge uphill battle. So local and state policy efforts are even more critical right now to protect workers and communities. And that also means folks like y'all, food policy councils, therefore being an incredibly important partner right now in this work. And so it's been exciting to see how these worker priorities have been translated into recommendations like what Jose Oliva is doing in Chicago as part of their COVID response, rapid response effort. And with that, I just want to pass it along to Jose. He's with the Heal Food Alliance and also the Chicago Food Policy Action Council to share more with us.
Thank you, Christina, and thank you, everybody. Thank you to the Center for Livable Future for inviting me, inviting us to speak here today. My name is Jose Oliva. I am not the co-director of HEAL. I was a co-director of Food Chain Workers Alliance, a co-founder. I am a co-founder of HEAL too, but not a co-director. That's okay. No, it's not a big deal. I'm the director of the I'm the campaigns director for HEAL. Anyway, so I wanted to talk a little bit about how local food policy councils in particular can actually be supportive of food workers in your regions in particular, right? So we all heard Claudia's story. We heard what's happening in Massachusetts, in the Northeast region. Very similar things are happening all over the country. Christina just outlined sort of the industries in which things are most dire. We know for a fact that restaurant workers are the hardest hit in terms of unemployment. Over 70% of restaurant workers right now are unemployed. And so there's efforts that both ROC United, the Restaurant Opportunity Centers United, and One Fair Wage have launched at a national level to get money in the hands of a lot of these unemployed workers. I would urge everyone who's listening to this to check out both of those relief funds, both on rockunited.org and onefairwage.org. And try to donate to the to the efforts, right, so that we can get money in the hands of unemployed restaurant workers. We also know that meat and poultry and other food processing workers are very hard hit right now because of the executive order that Christina talked about that Donald Trump signed on April 28th that compels the processing industry to continue to operate despite the high rates of infection. There's counties in the US where the infection rate is higher in rural parts of the country than in urban parts of the country per capita, which is an absolute disaster. And it is because of these meatpacking plants that are in those counties that are actually the epicenter of the infectious rate in those counties. So it is extremely urgent for all of you to help Christina and the folks at the Food Chain Workers Alliance spread the word about what is happening in the meat and poultry processing system so that we can urge Congress to fight back against the executive order that Trump signed on April 28th. And we also know that farm workers it's going to be the next wave, right? We heard about meat and poultry processing workers a couple of weeks ago, and farm workers are going to be the next wave, right? It's because of what Claudia said, right? There's no protective equipment, there is no sanitation processes on the fields. Even though workers are in some cases socially distant by nature in those in that industry, they have to come together with other workers in order to either dump the produce or provide, you know, the final product to the employer. So it's where the epicenter is heading in the next few weeks. And all of that is at the national level. So we'll share some tools for you all to work with us on. But at the local level, and this is really what I wanted to talk to you all about is, so I'm on the board of the Chicago Food Policy Action Council. And when COVID first hit, our response at the local level was really thinking about the food system that we want to see, right? And thinking about how the realities that I just described, right? The high unemployment in the restaurant industry, the huge infectious rate in some of the other sectors of the food system have created have sort of opened the eyes of a lot of folks in the country about what our industrial food system is doing to us. Because COVID-19 is the first experience that we have like this, but it's certainly not going to be the last. And if we don't make our food system resilient to the realities that are coming our way, our future is very dire. And so one of the things that we came up with was a plan for what our food system locally would look like if we wanted it to be truly resilient to these kinds of threats. And the first thing that we came up with was we need to grow as much food as we can locally. How do we do that, right? We train folks, we get them the tools and the knowledge that they need in order for them to be able to grow food in their backyards, in local plots, and so forth. And we know that that's not going to be enough, right? So we know that there's also a need for aggregation and for production at a larger scale. So we know that there's 70% unemployment in the restaurant industry, and we know that there's all these restaurants that are sitting idle. Can we employ some of those folks who are unemployed to do some of that aggregation and to bring food that would otherwise go to waste into these idle restaurants and do some meal prep and then provide those meals to some of the food insecure families and neighborhoods in the city that are potentially at risk of being hungry. And we know that there's that need is there, right? That there's a lot of folks who don't have access to clean, healthy, fresh food. So that's the plan, that's the vision, right? That we know, and we also know that if we do that, if we could accomplish that, that we would build the infrastructure for the food system that we want, that we need, right? A food system that takes care of the people by paying fair wages, by providing benefits and all of the necessary realities for workers, while simultaneously taking care of the earth by not bringing in food from as far away as California to Chicago, and simultaneously taking care of our local communities, right? And business owners, small business owners who depend on local customers. So that's the vision. In order for that to happen, we needed to have a set of policy recommendations from all of these constituencies that I just mentioned, right? Producers and eaters and workers. And so we started to have weekly calls broken up into those constituencies. And we're also going to share with you notes and the final, or not final, but the ongoing policy recommendations for the worker working group. But the meetings were happening in those working groups weekly, and we started to develop policy recommendations for each one of those constituencies. And then those policy recommendations are being put together into a broader packet in weekly calls of the what we're calling rhizome, or the sort of the collective of all of those working groups. And that final packet of policy recommendations lays out that vision that I just described right now. But we know that in order for us to get there, right, like that vision is not something that's going to happen overnight, and we know that workers are hurting now, right? So in order for us to get there, we need to make sure that we are astute and clear about how we are supporting workers right now. And so the policy recommendations that I'm sharing with you all are specific to the here and now, to COVID-19 impact to workers, and how we at the local level can make sure that workers are taken care of. And there's a heavy emphasis on undocumented workers in those policy recommendations, because they are the ones who are unable to access unemployment insurance. They are the ones who are unable to access most of the other benefits at the federal level, even in mixed status households, right? That means if you are a permanent resident and you're married to an undocumented person, you can't receive any of the federal benefits. Even if you're a citizen and you're married to an undocumented person, you will not be able to access, you won't even get the stimulus check because you're married to an undocumented person. So there's a heavy emphasis on immigrant workers and on undocumented workers in particular in that. Yeah, I think I'll leave it at that. Sorry that I'm rambling now. Thank you.
All right, thanks, Jose. I think I'm up next, Rachel. Is that right? Cool. Thanks, Jose, Christina, Claudia. My name is Nessia again. I'm from ChangeLab Solutions. We are a national organization that works to advance equitable laws and policies to ensure healthy lives for everyone. We prioritize communities that are at highest risk for poor health. Our goal is to undo the harms of structural racism and other forms of institutionalized discrimination by using the tools of government that have historically been used to create those inequities. I'm going to talk a bit about public health and food systems and food workers, why we're in this space, raise some flags that we like to do for anyone that's working in the policy sphere, and then go through some examples to complement what's already been shared of how food policy councils can sort of plug in to the policy process at the local, state, and federal levels. We look to organizations like Food Chain Workers Alliance, groups like HEAL and Jose and people like Claudia to sort of direct us in what we should be caring about and the issues that we raise. So I just want to thank them again for being here, and we're just sort of trying to come up behind and lift up the policy and legal opportunities to put those things into action. So first, why as a public health organization are we concerned with food worker issues? So shrinking the gaps in health outcomes does require more than sort of what we've done in the past with public health and addressing health problems directly, and even more than moving upstream by addressing the root causes of health problems. But we are finding that we need to find ways to change the distribution of health environments, economic resources, and opportunities in order to really get at these health issues. So when we're talking about food systems and the food supply chain, it still provides a unique opportunity, and many of folks who are working in food policy councils know this, to shape the health environment and social and economic outcomes of communities and regions and states and the nation as a whole. Each component of the food system, from production, processing, distribution, consumption, reuse, and disposal, influences these outcomes. And it doesn't occur in a vacuum. Sort of the way that we approach food systems and these values that we imbue in it, that the folks who spoke before me speak about, that drives the activities that happen across the supply chain. So that drives how workers are treated, what food is available, you know, who has access to it. And so a food system that values a valued workforce and, you know, well-paid workforce, a healthy workforce, and a safe workforce is going to shape the food system and improve individuals' outcomes, communities' outcomes, and the region's outcomes overall. So that's why we're here and sort of following the lead of these other organizations. And so when we talk about policy, and I just want to clarify, we're talking about both like what we call big P policy and little p policy. So big P policy is like city ordinance, state law, or federal law. Little p policy is sort of the institutional or organizational level policy. For example, like a grocery store in Nebraska can decide to give all its workers protective equipment, require them to wear it, or a state legislature can pass a law that requires employees of all food businesses to wear masks and for employers to provide that equipment. Both these policies are good and helpful, and food policy councils can engage in both these types of policies. The big P policy can affect broader populations because you're doing it across a geographic area, whether that's a municipality or a state or nationally. It can survive changes in leadership, funding, and political will. Not always, but it can. And although now is sort of is a tragic and traumatic time for many people, it's also become a political window with a lot of political will, in which this health crisis has made a lot of people in government and agencies more amenable to policy options that they might not have considered, been interested in, or found too challenging in the past. That there's an interest and willingness to sort of overcome barriers that there hasn't been in the past. So it's a really unique time to be working in this space. The next flag I want to raise, if you are going to be engaging at these different levels of government, is the concept of preemption I'm not going to talk a lot about it. It's essentially where a higher level of government can limit or eliminate the power of a lower level of government to regulate on a specific issue. So federal law goes over state or local, state law goes over local law, and it's not inherently bad. When you look at potential policy change, it's just important to consider if you're thinking about how to make change or how to plug in, is there another level of policy that's going to prevent or help you make that change? An example of this is minimum wage. Federal minimum wage, you can't go below that at the state or local, but some states do prevent localities from making a higher minimum wage. And then I guess the next and last I want to do before I jump into examples is talk about engagement and partners. And the folks who presented before me sort of embody this, but the engaging with the communities whose needs we're trying to address, but individuals and communities with less political power. And this is a category that often includes workers across the food supply chain, which it shouldn't, but in reality it does. Find it difficult to make their problems and needs visible to government and institutional decision makers and influencers like food policy councils. And so without representation in government and meaningful input from people who are lower on the social political ladder, these laws and policies cannot benefit them. They might try, but they likely will not. So food policy councils are really ideally situated to be this sort of connector between the communities that are experiencing health inequities and the governments that can change the policy and law to support them, to engage with these communities, lift up their experiences and needs, and translate that into policy change. So if you don't have food workers or someone that represent food workers, and this is not just business owners, represented on your food policy council, go out and get somebody tomorrow and make sure they're part of it. Because as we were talking about before, across the food supply chain, food workers are an integral piece of that, and any change you want to make for food systems has to incorporate food workers as a piece of that. And so when we're talking about policy, some of these examples I'm going to share are somewhat intersectional. It's not just about health directly, which is important, but policies that will support communities' access to opportunities. So that could be economic or labor opportunity, and access to income and other resources. So do they have food? Do they have reliable transportation, as Claudia talked about, quality healthcare, housing, etc. So start at the sort of bottom of the jurisdictional level. We have local policy that would include ordinances, resolutions, budgets, general plans adopted by a county or city council, and can also include executive orders adopted by a mayor. Some examples we've seen of that are like the Los Angeles City Council approving ordinances requiring grocery and food delivery companies to provide flexible work schedules. So workers could care for family members, they could go get tested, they can deal with changes in transportation due to the health crisis, as well as requiring that food businesses provided or covered the cost of personal protective equipment. We've also seen cities establish a process for food workers, all food workers, including farm workers, to have access to free coronavirus testing. So the city of Oakland is just one example that opened testing centers for free testing for all food workers as an essential group or a high-risk group. And another one that's incorporated in this is ensuring that food workers are included as essential workers in the provisions of services such as testing or as things like childcare. And then another one, I'm gonna hold that one off, that's a state one. Making sure, and this is a municipal or state, that all food workers have access to safety net programs, making them as broadly accessible as possible. At the federal level, I'm sure most folks are familiar with that undocumented workers don't have access to a lot of the benefits that would make going through a time like this easier and safer. And so broadening those or creating alternatives for workers who either don't have, are part-time and don't have health insurance, are undocumented and don't have access to those benefits would be helpful. And then another one that can be done at a local level is something that we've worked on a lot is procurement policy. And this isn't just, so food purchasing policies are not just for ensuring that the food purchased by an institution, a school district, a hospital, a local government is healthy. But you can also dictate that the supplier or the vendor or wherever the food is being purchased has fair wages and good occupational safety and requirements for all of their vendors. So, you know, a city could say that anything we purchase has to have, you know, they cannot have this number of OSHA violations, or they have to meet certain labor standards. So that's another way through sort of the demand that a policy can change how vendors, companies, farms are treating their workers. So then when you move up to the state level, this also includes laws, resolutions, statutes, and budget appropriations, and again, executive orders, which would be adopted by the governor. Going back to childcare, this is another place where you can ensure that all food workers across the supply chain are included as essential workers. In April, North Carolina was providing subsidized childcare for essential workers, which included farm workers whose children are US citizens or residing in the country legally. But it was unclear, and someone else may know it, I haven't gotten an update on this, whether families with undocumented children were eligible for this service. So again, folks having, you know, who school may not be in session, other childcare opportunities are not available, still going to work, you know, as food has been, food workers are often essential and have to continue to report to work, not just to ensure that the food system keeps working, but that they have a wage to bring home, and not having childcare available is a very big barrier. Another option is for the state level is supporting employers of food workers and providing hazard pay during the health crises like this. And this could be a budget item and continue through the economic rebuilding period. There are I think we'll talk about at the federal level, but there's currently a hazard pay for essential workers has just passed the House in the HEROES Act. So we'll talk about that in a second. Another policy at the state level that we like to think about is street vendors are another group that are often left out of support and protections and are often criminalized and can, you know, enter the criminal justice system for working to get a wage. So we recommend, especially in a time like this, and really at any time, working to suspend those penalties or decriminalize street vendor compliance violations. And lastly, paid sick leave or family leave. As of earlier this year, there were 12 states that had enacted policies that require employers to provide paid sick leave, and some localities, including Philadelphia, Minneapolis, and I think Seattle, also have paid sick leave laws. But there are still 22 states that explicitly prohibit or preempt localities from enacting these requirements. And even still, the vast majority of those states, or the vast majority of states still may not have those paid. There might be large companies, organizations that are not held to those requirements. So ensuring that those are not just available, but that all workers across the food policy spectrum have access to that. And on the federal level, this is a big jump and a very different space from the state and local level. Federal policy include federal laws that are created by Congress by passing bills that are signed by the president. Federal agencies also issue new regulations that have the same force and effect as law. So Congress will write a law and then they don't always know how it should be implemented. And so a federal agency will sort of have to sort out how those will be implemented. And that's where policy comes from, the agency level. And Congress will defer to an agency as the experts to sort that out. Agencies do, though, have to work with and solicit feedback from the public during each step of this rulemaking process. And that's where we see you'll see these requests go out for public comment. And so during this comment period, anybody, including, local government officials, advocacy groups, individual citizens, can submit relevant material to help sort of educate the agency about a regulation's potential impact, or to convey an opinion on the issue. So this is a significant way that local groups can plug in. And then, of course, on top of that, you can communicate directly with a representative, or hook up with an organization that are active on the Hill. ChangeLab is not an advocacy organization. I should probably mention that now that we're getting into federal policy. We cannot lobby or call for action on a specific legislation or legislative issue, but we can provide you with information. So don't hold me to any particular policy that I've spoken about. But at the federal level, we know OSHA standards that have been talked about are a big issue. The Congress just passed the HERES Act, which included hazard pay for essential workers. This still has to go to the Senate. So on any legislative issue like this, you can connect with your representative in Congress and in the Senate. And paid sick leave is another one that's come up during the pandemic. The federal government did include paid sick leave in the Families First Coronavirus Response Act, which guaranteed emergency paid time off for a variety of circumstances related to the pandemic. And while it provided some relief, it was temporary, and it was also incomplete because there were a lot of workers that are not included in this, including private employers with more than 500 employees, which are exempted, and that does include a lot of large food businesses. So that was a quick and long rundown of a lot of different types of policies that we think could be beneficial to food workers. So I will stop, and I think I'm passing it back to Rachel to do the Q&A.
Thanks, Nessia, and thanks all of you for sharing your insights and thoughts about the policy process and what needs to be done. So we're going to open it up for Q&A. So please, if you have a question for any of the speakers, type it into the Q&A box or also the chat box, and we can begin the process.
Rachel, there is one question already. And the question is there a movement for a nationwide workers' strike led by food workers and joined in solidarity by all workers? The border issue is a neoliberal union separation process. Worker solidarity across borders is needed. And this is for any of the panelists.
Christina, you're on mute, I think.
Yeah.
I don't know if there is I don't know of an explicit effort. I know that there is interest for a general strike, but
yeah.
Jose, do you have any more information about that, or know anybody that's leading that charge?
Yeah, so it's definitely something that is in the air right now that people are talking about. The thing that complicates that is that unions, once you sign a contract with an employer, most of the time that contract will have a no strike clause, which means that if the employer is not violating the terms of the contract, you can't go out on strike. And then additionally, if you have a union and you go out on a strike and the strike is not for what's called an unfair labor strike, which is something that's violating the contract that has been signed, it's considered an economic strike and you can be replaced permanently. So there's there's a lot of legal entanglements into how and why workers can strike if they have a union. If they don't have a union, workers can go out on strike. And so a lot of the talk right now, and just to be clear, less than 13% of the workforce is in the United States is organized inside of a union, right? So the vast majority of workers in the United States don't have a union, which means that if they do go out on strike, they're legally protected. If two or more workers in any given workplace take action to improve their working conditions, they are technically protected by the National Labor Relations Act. That's in every industry except for agriculture. So farm workers are not protected under the National Labor Relations Act. And there's a whole racist history as to why that is. But in every other industry, you can do that. And so that's the talk right now is, you know, what would that look like, and who would organize it, who would call for it, how many workers would actually participate in it, especially if they're not organized, then how do they know, right, that this is, that somebody's calling for a national strike and that they should participate in it. One last thing that I'm gonna say in answering that question is that the era right during the Great Depression was when we saw the largest growth of unions in US history, right? And every indicator right now is pointing in the direction that we will be seeing economic conditions similar to the Great Depression. And so that bodes well for the growth of the labor movement, which is good for the growth of the middle class, we know that, and it's also good for workers' rights, and it's good for our food system, because we know, right, that the better that workers are treated, the more likely that the product that they're producing is something that is going to be produced with care. Anyway, so I'll leave it at that, but it's a very intriguing question and a very fertile time to talk about it.
Thanks, Christina and Jose. Another question, this is for Claudia. Do you know of any organizations or national groups organizing for driver's licenses for workers or other allied groups that food policy councils can connect with?
Claudia, no sé si te están traduciendo la pregunta, pero la pregunta es si tú sabes de algún grupo o grupos que están organizando a nivel nacional para la ejecución de las licencias de
Sí, uno de los grupos que está trabajando para un proyecto de las licencias sería el grupo de cosecha que se encuentra en Boston, Massachusetts.
Yes, there's a few groups that are working on this. One of the groups that I know of is called Cosecha, and they're based in Boston, Massachusetts. There's definitely at every state. Sorry, I'm inserting myself into the answer of the question. But there is certainly in every state or almost every state a statewide immigrant rights organization. Here in Illinois, it's called the Illinois Immigrant Rights, ICIRR, the Illinois Coalition for Immigrant Refugee Rights, sorry. And every state has one similar, so you should look that up in your state because that should be your first stop to understanding what you can place inside of your local food policy council recommendations for immigrant workers in particular. And you can look at our policy recommendations. We tethered them to the ICIRR's policy recommendations. I would recommend doing the same with yours.
Thanks, Claudia and Jose. Another question, can any of the panelists offer examples of solidarity actions food policy councils have taken to support the initiatives of the Food Chain Workers Alliance or its allies? The Food Policy Council I lead is in a region where meat processing workers are facing massive problems, but the factories are all outside our actual service area.
Yeah, there's a couple of things. One is I can share the link to our petition that Food Chain Workers Alliance pulled together. It allows folks to write a letter directly to Congress, to representatives and senators, to support premium pay, health and safety protections, and federal relief regardless of status, immigration status. And writing to both representatives and senators, even though the House already landed on their bill, it's still really important to continue to get this message to both houses. So I can link that. And also I'll link again the call to action for those folks that are in New York State, those folks that are residents of New York State. The call to action today is calling on the governor to protect New York farm workers, essentially calling on New York State to pass, or the governor to pass, an executive order that would step into making sure that there's health and safety protections, including for farm workers, because there's no requirements right now for employers to protect their workers, the health and safety of their workers that is COVID specific. There are guidelines that the CDC has released, and they have released guidelines explicitly for businesses, which are actually weaker than the public guidelines that they released. And there is no explicit requirements for employers to follow that. So even if workers call and complain to OSHA and say, you need to come to my workplace and check this out, file a complaint, OSHA will not come unless somebody has died in that workplace, and yet still there are no explicit COVID guidelines for them to enforce. So we're still, this letter, this petition, and the work that we're doing with over 100 allies and organizations around the country, including some of y'all on this call, and ChangeLab and Heal Food Alliance, is putting pressure on the federal level, but also seeing states and governors take the helm and pass policy that can be covering and protecting our workers is also really important. So that is the long-winded way of saying I will include that link in the chat for those folks that are in New York State, and that again can be an example for other states as well. And then there's a social media toolkit that Jose and others at Heal pulled together, which is a resource if you want on social media to be calling out Congress and calling out these meatpacking companies, particularly the 5 largest meatpacking companies, which are doing little to nothing to protect their workers right now. And there's a whole call to action that, again, we've been galvanizing folks around the country through social media and through pressure we can apply there as well. So I'll include all of that. And I don't know if others have ways to support that y'all want to chime in on.
No, you said it all. That, I think that is the critical thing, is that letter to Congress, both the open letter that we sent to the Department of Labor and OSHA and Congress, that includes all of everything that we've heard from workers, right? The need to slow down the lines, the need for PPE, the need for social distancing and so forth. Those petitions are critical, and Congress can make those happen. And so please help us spread the word. There's a link to the social media kit. We definitely want as many people tweeting and Facebooking and whatever you do, TikToking. I don't know if there's a TikTok version of it. Yeah, thank you.
All right, unless anyone has another comment for that. Another question is it important for a food policy council to be independently funded and led? I'm assuming this is apart from city government. Can Jose comment on Chicago's, or others comment on their experience with government employed staff leadership?
Yeah, that's an excellent question. When the Chicago Food Policy Action Council first got started, it was a hybrid organization. We had city officials and NGOs also as part of the council. And what we found was that, it gave us access for sure. And it also allowed for us to temperature gauge what was possible and what wasn't at that moment in city council or in city hall. But it also hamstrung us, right? It quite frankly did not allow us to think creatively and think big about the kinds of solutions that we needed system-wide in order to address those issues more aggressively, right? So once we divorced ourselves from the city, we actually started to develop better relationships with city council and city hall because they started to work with us as partners rather than thinking of us as sort of an extension of them, right? And like some weird obligation that they had to meet in order to, be okay with their bosses. So personally, I would recommend, yes, be independent, be your own NGO rather than either a hybrid mix of government and non-government or an all government entity, right?
Thanks, Jose. This is a two-part question. How can a group of workers effectively put out a call to the governor or local government? Is there a formal process that needs to be followed, or is it just in the form of a letter that is sent? And the second part is, if a call is put out, is there any protection for workers who have put out the call? Many workers are nervous to lose their jobs or unemployment if they speak out.
I can answer part of that. Christina, you might have additional information on that. The last part of your question around what protections you have. Yes, again, if two or more workers are acting in concert to improve their working conditions, whether that is by taking action in the workplace to demand something of the employer, or whether it's taking action and demanding the government do something about it, they are protected by the National Labor Relations Act. There's also protections in the individual agencies that they're asking for help from, right? So if, let's say that those workers are asking OSHA to inspect their facility. OSHA is the Occupational Safety and Health Administration. If they're asking them for help, OSHA has specific protections against retaliation for workers who are asking them for help. So they're dually protected. Additionally, I would say that there's a lot of, I would not recommend that workers just take action on their own, right? Like just a couple of workers or a group of workers. I would really encourage folks to either connect with a local union or worker center, and you can go to the Food Chain Workers Alliance website to find a list of worker centers and unions all over the country. There's hundreds of them. Or if you are in a part of the country that is devoid of these organizations, I would at the very least encourage them to talk to either their food policy council if they're food workers, or another non-government organization that could provide them with infrastructure.
Yeah, and just to piggyback on that, I think to the first part of the question, and also related to what Jose is saying, I think that this is really going to take multi-sectoral coalitions coming together because it's an uphill battle. One, two is food workers are, I mean, we know how they're treated, right, in this country. Right now, we're deeming them as essential, but we're still treating them like crap. So I think that it takes a fight. And so as many people that can rally around together, and I think that includes food policy councils. If you want to take a look at the example from New York State, that was essentially a call to action that was developed by Essential Workers Coalition, but it also included worker centers, it included broad allies across the state. And they're doing, call-ins or social media or even earned media. These sorts of strategies can help to build momentum, build pressure, and also clarify exactly what workers are needing right now in this movement, in this moment. So I think, being creative and bringing together as many people as possible is a great strategy. And then using organizing and media and policy all together.
Thanks. And I know we are running short on time, but we have another question, and this might be the last one we'll be able to fit in. But for all panelists, some states are designating food and farm workers as essential to protect them from deportation and discrimination and to make more benefits available to them. Will this actually protect them? And what other steps do you recommend for us to explore, especially in more conservative states?
I can take a swipe at it, and then Nessia, Christina, Claudia, any of you, please chime in. I really do think it depends on the state, right? I think that there are definitely some states that are willing to go toe-to-toe with the federal government and are being very aggressive in protecting workers. I think there's also a lot of other states that are kind of in the middle, right? And they don't necessarily, either don't have the resources or the political will to, for instance, buildings that are either federal buildings or state-run buildings where there's a federal presence. And that's the real danger, I think, right? Especially for immigrant workers in mixed status households where they have to go to a government building for whatever reason. That's where they get scooped up oftentimes, right? Especially in courts, DMVs, that kind of thing. I also think that there's a role for NGOs in that, in making sure that they provide workers with both the information, right? The information about how the federal government can access them or can scoop them up in these circumstances, but also like the actual physical protection, right? Of being with them, accompanying them, right, to these appointments so that they understand the risks and could potentially get out of a situation quickly if they're perceiving the potential of being scooped up by ICE.
I think that's, and I think to echo what Jose said, I think it's going to depend on the state that you're in, the environment, political appetite for this type of policy change is going to vary. But I think that, whatever the issue that is important to the population of your state or the political leadership in your state, if your state is conservative, but the agricultural economy is a big source of income, speaking to the loss of income and the loss of economic confusion from agriculture by having workers getting sick could be, if speaking about immigration and undocumented workers is not palatable, which is, I mean, I think we talk about the root of being like racism and structural discrimination, but if it's just not palatable and you're not going to make any headway, then going to sort of what is the issue that's important, because the food supply chain intersects with all other issues that you're not going to be able, you are going to be able to find an issue that you can have an inroad to sort of, to take a route around the areas that folks maybe not be willing to talk about. So I think thinking about what issues are important to your political leadership is a good way to go about it, and how to connect that back to protecting food workers and food policy councils. If you are a group or an individual that is privileged with stable citizenship status, stable wage, stable income, stable job, that you are a critical piece to sort of, using your power and political voice to put those issues forward.
Thank you, Jose and Nessia. I also recognize that we have two people who've been raising their hands, and so we'll just allow them to talk very quickly, and then we'll go off. But if anyone needs to log off, please do. And thank you for joining us. So first, I'm going to allow Kelly Moltzen to talk. All right, Jose has to leave, so
sorry, I didn't realize that I had my hand raised.
Okay.
I'll just mention that. No, I mean, I am a convener of the Interfaith Public Health Network, so I am interested in engaging with all of of you to see how we can further this movement. So I'll just say that.
Thanks, Kelly. And I think that's it. So thank you all so much for joining us today. We'll follow up with a lot of the resources that were shared during the chat. And also this is a reminder for those of you who are asking for more examples of what food policy councils have done, that we'll have a part 2 next week where we will feature a few food policy councils and similar groups to talk about what they've done to support food chain workers and some media tips and communication strategies around talking to decision makers around labor issues during COVID-19. So to answer some of the continual questions around framing and strategizing. So thank you everyone for joining us, and gracias Claudia too.